My name is Larissa Benavides, and I'm going to be your hostess for the next 3 days. We would like to offer our warmest greetings to all of you after 10 years of success, 10 whole years of innovation, again and again, 10 huge opportunities for incredible networking, career boosting, and much more. You see, the only thing I regret is that I was not around in IMAP 1. I was a baby back then. Okay, no, I was a teenager, right? But things only got better. So let's relax and enjoy every moment that the 10th anniversary edition of IMAP has to offer. We will have the chance to travel back in time and see what has changed. And it wasn't little. So much took place over the last 2 years, and it's really hard to believe that we're all here back in a conference room. And a very important message should be conveyed today, my dear friends. The pandemic is not over. So please feel totally at ease to wear your face covers if you so wish. The one thing we cannot forget is to keep our hands clean. We are just about to knock this very nasty virus away. And we can't thank you enough for taking some time off your weekend, refraining from your family's company to improve your skills, to enhance your professional careers as clinicians. Thank you very much for being here. And this is called dedication. And by way of dedication, let us welcome our first speaker, who will talk to us about what's new and what's the same. So, the one and only Kazuo Miyake.
Good morning, everybody. It was not really easy to achieve this moment. IMAPX was going to be in 2020, but as we all know, it was postponed. We made IMAP live, and then in 2021 there was no need for an IMAP, and now here we are finally with a lot of friends I can see here, and from long-time friends, and we are going to start IMAP. First, I'm going to play a video. When I saw this video, it had a lot of messages, including the empowering of a woman. And then please play the video.
Stay with your brother. the pharmacist in here? I'm looking for 10 liters of Legroy.
You won't get those stains out of that dress. Better buy a new one.
It's not for my dress. It's for my carriage.
Are you trying to poison your horses?
Do you have 10 liters or not?
As you can see, it's not easy to innovate. It's painful, it's hard, and we need to change everything. We need to not be, to avoid being afraid of what's new, and we cannot, if we want to evolve, we need to do something really different. And that's why you are all here. And as a sailor, when we face difficulties, strong wind, waves, we change the settings, we change the direction, but we have one goal. And to reach that goal, we need to keep on trying. And that's how we achieve the results. And that's why you are here. And welcome everybody to IMAPX. This talk, I'm going to compare Clark's and Mercedes-Benz C-Class story. And in 1993, Mercedes-Benz released the first C-Class after the 190 model. And by that time, I was at the University of São Paulo making my residency in vascular surgery. I was beginning my residency in vascular surgery. My father, I was already a phlebologist because I started performing phlebology when I was in medical school in 1985. And I was learning all the what I need to know about vascular surgery, arterial and everything. And my father told me, right in the medical school, my first tip, he said, Kazu, use only dextrose 75%. Never use other sclerosing agent. It's really funny and different, but that he's my sensei. And I had to obey him. And I said, okay, if he's telling that, it's probably what I need to do. And then, by doing that, he said, if you don't have result, it doesn't mean that the dextrose is not strong enough. It means you have a feeder vein. You need to go to the feeder vein. And that's my life. I started, all that is a consequence. Clark's is a consequence of this knowledge and goal to just use dextrose 75%. Well, I started at using, in 1995, the intense pulse light, and then I started my PhD trying to find, because they told that intense pulse light could treat veins, and it really can, it's really difficult, And I saw that there was a lot of burning. It's difficult to know when it's going to burn or not. Then I decided to study the temperature variation as a predictive factor for a skin burn after interaction of light and skin. After that, in 1999, they released the 1064 laser. And this was really a great advancement, and I didn't need anymore the IPL. And as Mercedes-Benz, they release a new model every 7 years. During these 7 years, they kept evolving the car and testing and testing. And we were doing the same. We are never satisfied with the results. We are always pushing to the limits. Let's do better. Let's take photo documentation to evaluate everything and to see if we are getting the result. Then, in 2000, the Mercedes-Benz, they released the this 203 is the code for the second generation of the C-Class. And by that time, I was already starting using cooling device or contact cooling with ice. And I contacted the inventor of the vein viewer in 2005 to use his device that was developed for the vein access on the arms to study that device on veins on the legs. I created the acronym CLACS during this period of 2000 to 2007, and also I started using endovenous laser ablation in 2003. We have the honor today to have Júlio Ferreira, the pioneer in Brazil and one of the pioneers in the world of the endovenous laser ablation. He started, he's going to explain, but probably about around 2000 and with the endovenous laser ablation. And then, not satisfied with this beautiful car, the Mercedes-Benz kept developing, and we also kept developing. And I was curious why they have those parameters, the post duration. And the post duration, whenever they told us, use short post duration for telangiectasia and long post duration for bigger veins. And it was really difficult to change these parameters. You had to shoot 5 times to calibrate every time you change the parameter. That was impossible to be changing during the session. Then I decided to study, and I saw no difference, even with telangiectasia or bigger veins. And since then, I started using 18 milliseconds with that machine, and the newer one, 15 milliseconds, and that's the tip number 2. It really doesn't matter. It doesn't change. It's better to use less energy and cook because it's only temperature that we are using. A paper we wrote together, Sergio Janesini, with me, he found this paper really interesting, the outdated concept of thermal relaxation time. And that's in our paper. Then tip number 3 is the other misleading concept, which is the spot size, big veins, small spot size, small veins. The bigger spot size is not focused on the depth. The big spot size, it can reach the depth, but 100% of the energy will pass through the skin, through all telangiectasias. It will pass there. It's not focused. It's not like you are breaking a stone in your kidney, and the energy will focus in your kidney. You will feel something here on the skin, but the energy really will focus there. The energy of the laser is light. Light is coming through the skin. 100% is on the skin. Big spot size doesn't mean that the energy is down there. It means you can reach there, the depth. Then this is the tip number 3. Well, Mercedes kept evolving the car. And we also, as I said, and this is the W205, which is the 4th generation. And we were also in the 4th CLACS generation. And as you can see, I wrote here, C-Class, similarly to how we write with a small a for CLACS. And we started to have more ability, better ultrasound devices. We had a very good ultrasound device, but we bought a newer one with a better definition, and then we start to measure, and we create the Flebo suite concept. Because I had a lot of devices, I have a photography room, I have ultrasound room, laser room, and then as the patient was walking around the clinic, I said, why don't I have everything together? Because I am the only one here, and I want to have all the equipment. Then we created this concept of a Flebo suite. And Flávia Magalhães and Philippe Mamprin were the one that created told me the name of it. What would be the name? And as I said, the energy, it's pure light, and doesn't matter the pulse duration. You need to use less energy and cook the vein. We are going to talk a lot about this. Cook slowly. It's better to cook slowly with less energy. The vein is like a meat. If you put the meat on the oven with low temperature, like 70 degrees, instead of putting the meat on a grill with like a 600 degrees and we want to cook the vein slowly to have more a safer treatment, and also a pleasure treated with less pain. Then photo documentation was always also a very important step, where Marcelo Grill, which is a photographer and doctor, he introduced many concepts in the clinic, and thank you all the time, Marcelo. And one is the tethering, that we take the picture is already saved in the cloud. And, well, the perforating vein was also perforating the Claxet vein was also an important step. Maybe sometimes with anesthesia because it's painful, but some patients will tolerate. And we will show today how we do that. We cut the vein also after Clax, and the continued use of ultrasound during the session, and also the sedation. Now we have operating room, and I suggest everyone to go to this next step, to have a sedation operating room in your clinic, so that you can really treat everything. The patient comes in, and the patient at the same time can treat everything. And here, then, together with the newest C class, W0206, the 5th generation, here are the tips, and we are going to discuss a lot about this during our trainings. Well, thank you very much for being here. Now I'd like to invite Júlio Ferreira to come here and make his presentation. Não, acho que é piano. You need a piano?
To understand each little dream in me, someone to take my hand and be a teen with me. So nice, life would be so nice if one day I find someone who would take my hand and stumble through life with me. Someone to cling to me, stay with me right or wrong. Someone to sing to me some little samba song. Someone to take my heart and give her heart to me. Someone who's ready to give love a start with me. Oh yeah, that would be so nice. I could see you and me, that would be nice. to hold me tight, that would be very nice. Someone to love me right, that would be very nice. Someone to understand each little dream in me. Someone to take my hand, to be a teen with me. So nice, life would be so nice if one day I'd find someone who'll take my hand and summer through life with me. Someone to cling to me, stay with me right and wrong. Someone to sing to me some little summer song. Someone to take my heart and give her heart to me.
Thank you very much, Dr. Kazu, for this incredible talk as a great opening for our event. Yeah, it's always like that in IMAP, always innovating, right? And here, our hearts and souls are always longing for inspiration. As part of the celebration spirit that guards this edition, we have saved some special surprises for you. And just as a starter, we would like to invite Dr. Julio Ferreira. He is a very skilled vascular surgeon, but not only that, he is also a very talented musician, and he is here to inspire us. Dr. Julio?
Awesome. Awesome, Júlio. Pode colocar outro. I'd like to play another song that, by the way, you suggested. And pode colocar o slide. E eu queria pedir para todos, I would like to ask everyone 1 minute of silence. Pode colocar o slide. To all the COVID, death and war and all the sad things that happen in the world. And that's Julio's idea. And I really thank you for the friendship and everything. Feel free to sing.
Hard to use words now, right? Dr. Julio, amazing, amazing performance. Incredible. You see, and so inspired by this masterpiece, we are going to continue with our program. And this anniversary edition, we'll travel back in time and we'll recap some of the most important breakthroughs in aesthetic phlebology since its very beginning. So, Dr. Julio's talent is only one of the reasons why he's here with us this morning. The The other one is that he was one of the very first speakers at IMAP, right, Dr. Julio? And that was back then in 2011. Yes, incredible. So today he's going to tell us a little more about what's different and what's the same with EVLA. Please, Dr. Julio.
Okay, so
dear friends, good morning. Music and medicine, as well as my family, has always been my passion. But now I'm going to forget the piano keys to see what happened in the last 10 years with endolaser. These are my disclosure. Endovenous laser was idealized by Dr. Bonet from Palma de Mallorca, Spain, who communicated the Spanish medical community in 1998. And the next year, he published his first results in the Revista de Patología Vascular. This is the publication. The first presentation in an international congress was in 2000 at the Pan American Congress of Phlebology in Cordoba, Argentina. I was there, and in the same year we introduced endovenous laser in Brazil. The presentation of this technique as an option to stripping has not a good reception and generated criticism and resistance. Despite the high rate of recurrence, lymphatic, neurological, and anesthetic complications of the surgical treatments. I remember that Dr. Bonet was crucified in that Congress by doctors from the four corners of the planet. In Brazil, it was not different, despite the recently death of this girl, Clara Nunes, a famous Brazilian singer, who had fatal complications of an anaphylactic reaction during stripping. But scientific evidences began to appear, and EVLT was finding its space. And today, according with the last ESVS guideline published this year, and supported by more than 500 bibliographic references, endovenous laser became the gold standard treatment. And as you can see here, with a strong recommendation, 1A, for the treatment of GSV, which already had the previous American and European guidelines. So it maintained its position and recommended as the first choice treatment in preference to stripping or foam sclerotherapy. And stripping, according with these guidelines, could be considered only if thermal treatments were not available with a novelty. The possibility to treat very large veins, as we can see in this recommendation, 53. And also, the possibility to treat the anterior accessory saphenous vein, as seen in recommendation 46. Another novelty that appeared in these guidelines is the treatment of short saphenous vein with endolaser, which was uploaded to 1A, like GSV in preference to surgery and foam sclerotherapy. And also other non-thermal, non-tumescent treatments. Endovenous laser is recommended as a first choice for GSV and SSV. But what do we do with perforated and varicose veins? Many years ago, Dr. Bottini in Buenos Aires, Dr. Carmelino in Lima, me and other doctors are using endovenous laser as an off-label technique to treat varicose and perforated veins. Lately, some groups advocate the use of the endovenous laser to treat all varicose veins. This, of course, is possible, but it's good to keep in mind that is an off-label treatment, not supported by the guidelines, which only advise phlebectomy, sclerotherapy, or a combination of both ones. Regarding wavelengths, the procedure introduced by Dr. Bonnet used 810 laser. But over the years, other wavelengths were checked like 940, 980, 1230, and lately 1470 nanometers, which seems to have established itself at the choice wavelength. But recently, a new laser source was introduced delivering 9040 laser. We have not checked that then because they are not approved in our country. I've searched the web, and there are not many publications in this matter. But I found this paper comparing 1940 with 1470 in 139 patients, and the conclusion of this publication is that it's safe and effective as 1470. Another innovation of endovenous laser comes from its creator, Dr. Bonnet, whom I spoke last week. He told me that now is associating sclerotherapy with endolaser. He argues polidocanol has an anesthetic action, and it also has an absorption window for the laser light. So using PLD and laser together, it is possible to use less laser energy and minimal amount of sclerosing foam, allowing to perform the ablation without anesthesia. For this, he is using his special catheter that allows to introduce both foam and laser fiber. The only publication that exists is this one, with a very little number of patients treated and with good results. And finally, a word about fibers. The consensus is the superiority of radial fibers because they deliver even energy in the vein wall, have better results, and also allows to perform endovenous laser without TLA. Like our group shown in this publication at Acta Phlebologica. Summing up, today, endovenous laser is the gold standard to treat both GSV and SSV. Stripping should be considered only if thermal ablation options are not available. Anterior accessory saphenous vein, very large veins over than 20 millimeters, and also perforator veins and varicose veins, could be treated with endovenous laser too. 1470 remains the best wavelength available today. And finally, radial fibers are better to bear tip ones. Dear friends, thank you for your attention. Thank you, Dr. Miyake, for the kind invitation, and congratulations for this beautiful meeting. Thank you much.
Thank you. Thank you very much, Dr. Giulio. Amazing trip back in time, right? Well, as frequent IMAPers, I am pretty sure that most of you here have heard of the Hiroshi Miyake Award. So this award is a traditional award, which is granted to those who have given outstanding contributions to the field of aesthetic phlebology with their research efforts. So Dr. Marcondes Figueiredo is going to join us online, and he's going to tell us more about this award. Do we have Dr. Marcondes with us already?
I am a vascular surgeon in Brazil. First, I would like to thank Felipe Miyake for helping me. This is the publication about the surgery. Do you use transdermal laser instead of vector? The majority, no. Do you combine sclerotherapy with other therapeutic procedure? Surgery and sclerotherapy is majority. Do you use any procedure to reduce the pain? The majority do not. How long do you use compression after sclerotherapy? The majority less than 12 hours. Do you photograph patients before and after treatment? The majority said no. Do you have cardiac resuscitation equipment in your clinic? The majority, no. This research is done in 2011. Let's compare about the 2022. We can observe a change on the glucose and polydocanol nowadays. Transdermal laser. With the growth and international recognition of the trough methods, there has been increase almost 60% in the use of transdermal laser. About the photograph. Nowadays, documentation is more used. It's very important, the photograph. Recommendation about the sunlight. 10 years have gone by and there is will no consensus among vascular surgery. Current research shows the care with patients have increased. More than 50% have in their clinic. Do you use procedure reduce pain during sclerotherapy? Today is more used cold air. How long do you use the compression after sclerotherapy? It's the same. Thank you for your attention. I desire success IMAPX. Thank you very much.
Well, thank you so very much, Dr. Marcondes. And Dr. Marcondes is still live online with us. Maybe if you have any comments or questions, this is a good opportunity, so feel free. And you can just raise your hands and we can bring the microphone to you, or if you are interested in writing your question, please let us know and we can collect the question and have him answering, okay? Feel free. Well,